On the morning of February 29th, the world turned its attention from news of the coronavirus in China and Europe to the Seattle suburb of Kirkland. What was predicted by public health experts had arrived, the first COVID-19 outbreak in the United States, and it was spreading in the most vulnerable of places, transforming a 5-star skilled nursing facility into the first hot zone in the country. It was our initial encounter with the invisible enemy, and on display, the federal government's readiness. Despite President Trump's message at the time, COVID-19 was not going away. So far, more than 9 million Americans have been infected, and 230,000 people have died. When the virus struck in Washington state, there was a lack of testing and personal protective equipment. Instead of jumping in to help patients, the federal government jumped to questionable conclusions. Tonight, we'll take you where the outbreak started and show how events unfolded.
The story will continue in a moment.
This facility was ground zero. Nancy Butner is a vice president at Life Care Centers of America. We met her at the Kirkland nursing facility she ran for 14 years. We are the only reporters to be allowed inside since the coronavirus cut a deadly swath through this facility. Today, it's a quiet, COVID-free place, a stark contrast from what happened here 8 months ago. We began speaking with Butner remotely in June. In the end, how many people did you lose to this disease?
We had about 38 patients that had passed.
And staff?
We lost no staff. There was about 67 staff, I believe, that were diagnosed with COVID.
On February 12th, before anyone suspected COVID-19, Nancy Butner's nursing staff noticed a cluster of residents with the same respiratory illness. Days later, more would come down with a fever and cough. By then, Life Care knew it had a respiratory infection spreading in the building.
911 emergency. She's having difficulty breathing, or can she?
Absolutely, and she was diagnosed with pneumonia a couple of days ago.
One by one, Life Care started sending sick residents to nearby Evergreen Hospital.
She's short of breath.
We thought we had pneumonia, patients with pneumonia.
At that time, could you test for COVID-19?
No COVID-19 tests were available.
In February, testing for COVID-19 was limited to the CDC's lab in Atlanta and reserved for people who had traveled to China or had contact with an infected person. None of the patients then in Evergreen Hospital qualified. And when the government moved to expand testing operations, the tests they shipped to public health labs were defective. The CDC's test was the first one approved and the first one put out there, and it didn't work.
It had a problem with one of the components of the test caused some false positives.
Dr. Jeffrey Baird chairs the Department of Laboratory Medicine and Pathology at the University of Washington School of Medicine. He watched as the administration's bungled rollout stymied national testing and surveillance as the virus gained a foothold in the United States. Scientists in Baird's world-renowned lab had been monitoring the novel coronavirus since December, and Dr. Baird had invested millions to prepare for it, including making their own COVID-19 test.
We could make a drug test to detect heroin, or we could make a blood test to detect cancer. We can just do those, and then we can just offer those tests. We could have done that also for this.
They first needed emergency approval from the FDA and ran into one bureaucratic wall after another.
You have to send in the paperwork on paper, then you also have to send it in on a flash drive. And then to gain approval, you would need to prove that the test worked on a larger number of cases than actually had been reported in the United States.
It's fair to say that this was all going on at a time when we really needed those tests.
Oh yes, of course.
As more cases of COVID-19 were confirmed in the U.S. and public health labs were still saddled with the faulty CDC test, Dr. Baird's lab, along with the Association of Public Health Laboratories, beseeched the FDA to let them use their own tests. Dr. Francis Rito is the medical director of infectious disease and prevention at Evergreen Hospital, where sick patients were filling the ICU.
It was on February 27th that they announced that testing would be available at the local health department beginning on February 28th.
Dr. Rito wasted no time testing 2 patients, including a 73-year-old woman from Life Care whose symptoms had started 9 days before.
So that night, the chief of epidemiology called me and said, "You have 2 positives." And I thought the odds of 2 individuals in a suburb of Seattle just seemed too implausible.
He then tested another 42 patients. 32 came back positive for COVID-19. 20 were from the Life Care nursing facility. It must have indicated to you that this virus had been spreading around the community for days, if not weeks, before it popped up on your radar. So you knew it's out there.
We knew it was out there.
I got a call at home about 11:30, 12 o'clock at night on February 28th that we had a patient that tested positive.
Overnight, this tidy one-story building became the face of the first outbreak in the United States. Inside Life Care, Nancy Butner and her staff were the first to witness how wily this virus could be.
I think one of the most difficult things is that we didn't know what it looked like, and we didn't know what it would do to the patients those early days.
It almost sounds like the virus was getting away from you.
Oh, there's no question that we were not in control. The virus was in control. We couldn't readily test for it for that first week, so we didn't know if patients had it or not.
It came down to a guessing game of who they thought had COVID-19 and who didn't, isolating some and not others. No one in this country had come up against anything like this before. Butner's staff had to improvise PPE on the spot, buying up oversized men's shirts and wraparound dresses from Walmart, while 40 of her employees, including the medical director, became sick and could no longer come to work. Outside, the media gathered to film the parade of ambulances and talk to heartbroken family members.
We wake up daily to news of another death.
My mother, I got a phone call this morning that she passed at 3:30 in the morning.
This is a picture of my mom. Back in 1979, they transported her to Evergreen Hospital, and by 6 a.m. she had passed away.
As if responding to a slow-motion mass shooting, local authorities declared a multi-casualty incident, putting hospitals on notice to receive critically ill patients.
I felt like I was standing on the beach looking at a big tidal wave coming at us.
Dr. Jeffrey Duchin, a 22-year veteran of the county health department, was in charge of the local government response to Life Care. We met him on a windy afternoon in Seattle. This is the kind of public health outbreak that you've trained for your entire career.
It was overwhelming in so many ways because it erupted so quickly, so unexpectedly. There was just a lot of desire in our public health community to try and do something about it.
Knowing the virus was way ahead of them in the city of Kirkland, Dr. Duchin raised the alarm with the CDC, asking for a team of epidemiologists, disease investigators, and lab support. And with Life Care's essential staff down by a third, Nancy Butner called in a federal lifeline of doctors and nurses. 3 days into the crisis, you write to the Department of Health and Human Services and ask them for a strike team that comes out within 24 hours to tackle emergencies.
Right.
You wrote to them, quote, "We will agree to whatever it takes to receive federal assistance." Simply stated, we are desperate for licensed nurses and nursing assistants. That sounds like a real cry for help.
We desperately needed staff. We needed nurses and aides to help us care for the patients.
In the first 4 days, 27 Life Care residents were taken to the hospital. By the end of the week, 7 residents had died inside the home. With a house on fire, it would take not 24 hours, but 5 days for the strike team to arrive. But before doctors and nurses turned up, another federal agency moved in, the Centers for Medicare and Medicaid Services, not to help with patient care, but to investigate the nursing facility. How did that impact your ability to care for the residents in the middle of this crisis?
Hours of staff time were averted to managing a survey process instead of managing a crisis in the facility and patient care.
So these federal investigators showed up before the federal strike team came to help you.
Yes.
Did that make any sense to you?
It was infuriating. They didn't truly understand COVID or what the facility was going through or what we had been through.
Did you say to them, look, we are in the middle of a crisis. Why don't you let us handle this crisis and then we'll answer your questions?
They knew how many staff were lost. They knew how many patients were hospitalized. They knew there was a lot of patients that were sick and it was an unknown virus. I explained that to them, but I can't tell them to leave.
But state health officials tried to do just that. We searched hundreds of public documents and found emails that show they pressed the governor's office to get the federal inspectors to call this off. According to Life Care Centers of America, federal inspectors interviewed employees and demanded thousands of documents, diverting more than 400 hours of staff time away from patient care. The result was a 48-page statement of deficiencies, which said that Life Care failed to manage the outbreak, putting residents in immediate jeopardy.
Seema?
We wanted to speak with Seema Verma, the administrator in charge, about the timing of the inspection and the findings. Her office declined multiple requests for an on-camera interview.
I think they wanted a scapegoat for what happened at Life Care Center Kirkland. I think that they wanted someone to blame for COVID-19 spreading. We had nothing to do with the spread across the nation.
Life Care was fined more than $600,000. In addition, the state inspectors working in partnership with federal investigators filed their own report accusing Life Care of the same serious mistakes they say cost lives. Life Care appealed both, and in September, a judge in the state case sided with the nursing facility and concluded that it was not a case of negligence. Although the federal case is still pending, Nancy Butner sees this as vindication for Life Care of Kirkland.
He found that everything that we did during that time was appropriate. He ruled in our favor. I think that it was very clearly written by the judge that what we did was the best that we could do.
During the first week of the outbreak, the CDC warned skilled nursing facilities in the U.S. are at the highest risk of being infected by coronavirus. Still, nearly 80,000 nursing home residents have died nationwide. And the people who battled the first outbreak in Kirkland, Washington, they worry the country wasn't paying attention.
I think the messages that we sent out in those first 5 days were a stark warning.
What do you mean?
That it's coming. The numbers are expanding on a daily basis. You better be prepared.
Who's responsible for the missteps and mistakes?
It took a village to screw it up this bad. We don't really have an approach to public health that works really well in this country.
Sounds like you give the U.S. a failing grade.
I am not happy with how we responded, and I would hope that we learn from this and do better the next time. Because there will be a next time, for sure.